Hello, my name's Danielle Banks. I'm one of the veterinary nurses based here at Davies Veterinary Specialists. We're a small animal referral practice, and today we are showcasing the Veterinary Nursing Awareness Month, which is in May. And I'm joined here today by my colleagues Hannah Perry and Nicole Neat. And we're going to be discussing a little bit more about emergencies that we see here at Davies Veterinary Specialists, and also providing you, the owner, with some first aid tips, things that you might be of interest to you to help your pet at home. So as a referral practice, we don't see general emergencies that you might be encountered at a first opinion level, and certainly if your pet has an injury at home, then the first port of call would be your general practice. But we do see emergencies. Sometimes first opinion vets will call up to say that they've seen a pet and it is in particular difficulty and that they wish to refer it. So we certainly need to be set up here for emergencies. And I guess, Hannah, probably as a patient ward nurse, you're probably the first port of call if an animal arrives at the practice as an emergency. Can you tell me a little bit more about this?
Yep, absolutely. We have lots of emergencies that can potentially come in during the day. They can range from 1 up to sometimes 10 on a particularly busy day. If they're very sick, they may be taken straight to our ICU, where the dedicated ICU nurses will look after them until the clinician arrives and comes to assess them, or they may come straight into wards. It just totally depends what they have presented with.
So as a nurse, probably your primary role will be triaging these animals, will it, when they arrive?
Yes, certainly. We will go out to the owner's car and we will assess the pets sometimes and leave them with the owner, or sometimes, as I said, we will take them to our ICU ward if needed.
I imagine your training really kicks into play there when an emergency comes in, especially that team approach that you need to be ready for.
Yes, definitely. When the emergency arrives, the reception will alert the clinician or the ward supervisor or the ICU nurse as to where the patient is located. If we need to go out and triage the patient, as I said, we can do it in the owner's car and then take them to the appropriate place. It just completely depends on the presenting problem with the patient.
Okay. What about you, Nicole, as working in theatre? Is that something that impacts you greatly, emergencies here at Davies?
Absolutely. The same as Hannah said, really. It can be 1 to up to 10 emergencies a day, and maybe not all of them would require a surgical intervention, but certainly a proportion of those cases do come to theatre. Because we are a referral centre, they don't normally just turn up immediately. We do have a little bit of forewarning, so we as theatre nurses and ward nurses can be hopefully completely ready for that patient that's going to come in. And again, our support staff are really invaluable in that, and they will help us get theatres ready, get surgical kits ready for these emergencies that come in during the day and through the night. And that's where our on-call team will take over and continue that care for that patient.
And can these emergencies turn up at any time of the day? Is it just during the day, or can it be at weekends as well?
Absolutely, yeah, any time of the day. We also have theatre nurses that are on call at the weekends, and we start at 10 o'clock in the morning, and our second shift would finish about 8 o'clock at night. But this nurse would also be on call, so if there's any procedure that's still going on, they would continue with that case. Sometimes would have finished for the night and have gone home, only to be called back in again for another procedure.
So for some of you as pet owners, you may have already encountered first aid situations at home or while you've been out and about with your pet, and it can certainly be sometimes quite a distressing situation for yourself and your pet. Now, have you both got any tips that you can provide to our owners in those first aid situations, and just to sort of generally how to manage the situation?
Most importantly, you need to stay calm. Pets can pick up on our own stress levels and anxiety really, really quickly, and that can potentially distress them even further, which can exacerbate a situation unnecessarily. So stay calm, It will help to keep your pet calm and just assess the situation safely and then take action as appropriate.
That's a really good tip. Thanks, Hannah. What about you, Nicole?
I think having some form of first aid kit on your person or in the back of your car if you're going out on a day trip with your pet. Just has to be something small, you know, a few bandage materials, some clean swabs or gauze and some saline, just so that you can treat anything immediately or try and stem any bleeding if anything happens while you're out on a walk, until you can get your pet to the vet.
Now, we've done some first aid courses here at Davies. Is that something that you'd encourage owners to attend?
Definitely, absolutely. It will give you some basic knowledge of how to deal with first aid in that kind of situation, and just some really simple steps of things that you can do to help look after your pet until it can get to the vets.
Yeah, I think many people, you know, if they have children, the first time, you know, you have your child, you attend, don't you, a children's paediatric first aid course. And sometimes, you know, maybe having an animal, we don't sort of always think about that. So if owners are interested in attending a first aid course, are there any important things to think about?
You may find that your own general practice will offer certain first aid courses that may be available to owners. We certainly have run them in the past here at Davies, and I think we hope to do them again in the future. But most importantly, you just need to make sure that if you're researching something online, that it is a registered veterinary professional that's providing these courses.
Although we mentioned that it's great for owners to attend first aid courses, it's really important that this certainly doesn't replace the expert care and advice that any veterinary professional can give. If you're ever in a first aid situation, then your first port of call should be to call your general practice, and they will provide immediate advice over the phone and let you know whether you should attend your practice or if you don't, it's not necessary, and they can advise you further. And certainly in an emergency first aid situation, the more notice that you can give to your general practice that there is an emergency, the better. What sorts of things that would be happening in a general practice before the owner arrived if they were to sort of call in advance?
Well, I would imagine that they'd just be able to get prepared for the situation depending on what was wrong with your pet. They would just have any equipment or any diagnostic things that they need to have available ready. One thing as an owner that you could do is if your pet has eaten something inappropriate, you could take the packaging, or if it's eaten chocolate or anything like that, you could try and have a gauge of how much they've eaten and let the vet know how much it's eaten, or like I said, take the packaging with you so that they can be prepared.
Yeah, that's really good tips actually. Thanks, Hannah. So as owners, many of you will have seen veterinary ambulances as you've been out and about. Nicole, can you explain a little bit more about what the veterinary ambulance is for? Is that like we have as humans? Do they take on the same role for our pets?
Actually, no, that's a little bit of a misconception. The veterinary ambulances that you may see out and about on the roads or parked up at your veterinary practice are really for transporting your pet to another practice for the overnight care, or transferring them to a veterinary hospital, referral hospital. So not really for the first aid situation or triaging situations like we have for humans.
So in an emergency situation, Hannah, would a vet come out to the home?
Very occasionally, but generally no, because I think most pets would need to be seen within the veterinary setting, so at your referral vets, at your general practice. So no, not really.
Okay. So really it's on the role of the owner to get their sick pet to the veterinary practice?
Absolutely, yeah.
And what about if they just turn up at a practice with their very ill pet? You know, do they need to have called in advance?
Ideally, yes, you need to phone ahead so that everybody can be forewarned and be ready for your arrival. But sometimes if something happens when you're out on a walk and you just bundle your pet into the car and get to the vet, then obviously that's a slightly different situation. But ideally, yes, if you can phone ahead, then that's great.
So we've already talked a little bit about the importance of staying calm in a first aid situation. Hannah, do you want to give a little bit more of information about how to approach a first aid situation generally?
Yep. So I think it's important to remember that your pet may be frightened, or probably will be frightened if it's hurt itself. It may potentially be in pain. So alongside staying calm, you'll need to approach it very cautiously and slowly, and then make sure that you restrain your animal appropriately so that it can't run away, because sometimes animals do decide that they want to run away when they're in pain. So it's important that you try and pop a lead back on, or obviously if it's a cat, try and restrain it in some way so it can't run away from you. Staying calm will help your pet to stay calm in those first aid emergency situations.
Okay. So if you think maybe about a specific problem, certainly one that I've encountered myself as a pet owner is a cut. With my dog, it had managed to go under a bit of barbed wire and sustained a cut to its back. So if there is sort of a cut and a bleeding situation, Nicole, is there any sort of tips that you can give to owners on what they should do?
Sure. So obviously, as Hannah's mentioned, it's really important to stay calm so you can assess the situation and just pause for a second and think, what do I need to do? I need to call the vet. Have I got everything I need? Right, okay. Have a look at your pet. Where is the cut, first of all? So it depends on where that is as to how we can actually try and stop any bleeding, how big the cut is. But basically what we need to do is try and stop that bleeding somehow. So the first thing that we would need to do would be to apply some form of pressure, and that will depend on whereabouts on your pet the cut is. So if it's on a leg or a foot, and you have any bandaging material in your car, in your first aid kit, brilliant, then we can try and rinse off any dirt or contamination if possible. If we have any bottled water in the car, if we've been out for a walk, we can rinse the wound and try and apply that pressure with some bandaging material.
What about if they don't have bandage? I mean, is there anything else that an owner could use?
Of course, if you've got any item of clothing or cloth, or if you've got a pet in the car, you quite often have some blankets in the back of the car, a picnic blanket. Just apply whatever you can find, or even take your t-shirt off and use that. Whatever you can find, really, just to apply some form of pressure.
And then the important thing, presumably, is just getting to the veterinary practice, and then they can assess that cut further.
Of course, and as Hannah said before, to try and phone ahead. It might be that you're not near home and that you might need to ask someone to, please, can you go find the local vets for me and get me their number while I deal with this, and then I can phone ahead and let them know that we're coming.
So that probably leads on to a really important point about, knowing where the nearest veterinary practice is. I mean, when you're, in the home situation, all owners, pets are going to be registered with the veterinary practice. But certainly if you're going on holiday, it's a really great idea, isn't it? Just to sort of check where your nearest vet is and see what facilities they provide.
Definitely.
So Hannah has mentioned that sometimes when a pet is in distress or hurt, they can behave quite differently. And obviously, as an owner, your safety is paramount, as well as administering first aid to your pet. Are there any particular behaviours that an animal may display which you should be wary of if they're in distress?
Yep, certainly. So if your pet is hurt, it may vocalise, it may whine, it may whimper, it may bark. Quite often, if they're anxious and scared about the situation, they may become fear aggressive. So they may there is a potential there for them to bite you, which you obviously need to be very careful of. But this will obviously not be a normal behaviour. It could just be because they're frightened and in pain. But other signs to look out for could be their tail maybe between their legs. They may have their head lowered down. Their eyes will probably be quite wide open, showing that they're fearful or scared or in pain. They may growl when you approach them, and as I said before, they may try and bite when you approach them or restrain them because they are very scared and potentially in pain.
So that can be quite a difficult situation to deal with. I guess one tip that I would give would be making sure that you get a lead on the animal as quickly as possible, so that they're not going to run off. And certainly, I know in our next talks, we're going to be talking a little bit about how to restrain your pet so that you can examine them carefully.
I think with cats as well, I think cats can be quite vocal and hiss and growl and swipe out, but then they can also be really quite quiet and sort of go into themselves and just try and hide and escape the situation. So if you had a big blanket or something that you could just cover them and it's all nice and dark and quiet, they may not sort of try and flee or fly away from that situation.
Yeah, really good points.
And try and just keep them safe in that space.
So we've discussed lots of different tips about first aid today, but are there any other things that we may not have already covered?
I think it's important to make sure as an owner that you only ever give your pet medication that's been prescribed by your vet. As an owner, you may have drugs like paracetamol at home, for example, but this is extremely toxic to cats and should never be given under any circumstances.
Okay, and what about if a friend, for example, has given a particular drug to their pet before and it's been fine? Would that be okay?
Again, I would just ensure that you check with your vet in the first instance before giving anything to your pet.
Okay. Now, the internet obviously, is widely available to everybody, and we all use it for lots of tips and things. Is that a great source of information for tips and advice on first aid?
I think it can be, but I also think that owners can read some advice and maybe take it to the extreme or take it in the wrong direction, and then maybe worry unnecessarily about certain situations. So I think rather than looking online, I would speak to your vet in person or over the telephone first.
Okay, thank you. Thanks very much for your time today, and thank you Hannah and Nicole for joining today as well. If you do have specific questions about your first aid for your pet, or indeed any medical questions, then certainly do get in touch with your veterinary practice. Thank you.